Hello, you're Eleanor Darcy.
Yes, that's me.
Hi, welcome Eleanor Darcy to Align Time Massage Therapies. My name's Sue Francis-Plunkett and I'm a remedial therapist here. And I believe you've come along to us today with a really sore left shoulder.
Yeah, it's been really killing me at the moment. So I'm really glad that I've been able to get in to see you.
Tell me what happened with that.
I think I was reaching up to grab something off the top shelf and sort of jerked funny. On this one, sorry. And just sort of a slight twinge in my shoulder, and just haven't been able to shake it yet.
Okay, so it was just a one-off time of reaching up. And do you ever have any other back or neck problems at all?
Not particularly. Sometimes I get a bit of mid-shoulder pain, but not like this.
Right, okay. So just going through your client history form, you're currently a student at university. And what are you studying, Eleanor?
Oh, I'm just studying science.
Okay,
yeah.
Oh, science, okay. That's
yeah.
And your health history, you've got a pretty pristine health history, a little bit of allergy. Tell me a bit about that.
I've only really had allergies to like pollens and grasses and a little bit of latex. So really just quite normal, hay fever type allergies, and then an abnormal like skin condition to latex.
Yeah, okay. And are you currently using any medication for the shoulder pain?
I took some Panadols before.
Okay, was that helpful?
Yes.
And did you end up taking, does heat or cold help with that? Do you put any hot packs on or anything like that?
I put a cold pack on afterwards, but I haven't done any heat.
Okay. And you're not currently taking any medication, as you said? No, just the Panadol, that's pretty much it for that?
Just Panadol, yeah.
Yeah, sure. Okay. And I noticed just with regards to the consent form for the treatment, you've actually initialed each of the points that are on the consent form. Was there anything that you wanted to clarify with me before we move forward?
No.
You're happy.
Nothing.
Do you understand remedial therapy is a little bit different to the typical spa therapies, insofar as that remedial therapists treat a problem more than anything else? So it's not like a whole body massage you'll be receiving today. It's more a targeted therapy for this shoulder and the surrounding muscles that could be contributing to this problem.
Yes, yep.
Typically, just to give you some sense of time frames, the massage today will be probably about 50 minutes long. I'll allocate about 10 minutes for the assessment and devising the treatment plan. But what I'm anticipating is that you'll probably need to come back and see me in 10 to 14 days for further evaluation of the injury. If you find that you need to come back sooner than that, feel free to do so, but I'll probably try and leave it at least 7 days for things to settle a little bit. And when we send you home, we'll send you back with some other things to do, some gentle stretching and some hot and cold therapy to try and bring that inflammation down, which potentially could be part of that injury that you have.
That sounds wonderful. Thank you.
We'll come up with a postural assessment too to see why the muscle actually was so tight when you did just a simple lift as well.
Mm-hmm.
Now, as you probably see today, there's actually a toilet and change room just adjacent to the treatment room. Feel free to go in there. I need you to take off all of your upper gown, upper clothing, because we'll be treating that neck and shoulders. If you have a little cami underneath, you can just have that on if you want to, and we can just drop that down as necessary, but you've always got a little bit of clothing on for privacy if you feel more comfortable with that. When you come out of the change room, just pop onto the table, and it's warm, it's a heated table, so it should keep you relatively comfortable. And then we will there's some towels also to drape yourself, and we'll get started with the evaluation of your range of motion. And as we step through it, I'll explain to you what I'm doing and why I'm doing what I'm doing. And then from there, I'll explain to you what the treatment plan will be again. And then probably today, as I said, about 50 minutes to an hour of treatment time. And then we'll go out into the reception area and devise the times, come up with an appointment time for when you come back. Does that seem okay for you? And you've got no time pressures on you this morning to be here, or? Great.
No.
All right. And look, if anything's been missing from your health history that suddenly occurs to you as we go, please don't hesitate to let me know, because I can update the treatment form as we go, and, just keep on board with what your goals are. All right? Not a problem at all. Thank you so much for coming in, Eleanor, and I'll leave you to get changed. I'm just going to step out of the room to do some administrative work on your notes. I'll be gone for about 3 minutes, and then I'll come back in and we'll get going. All right? Thanks so much, Ellie. I'll be back in just a tick. Get yourself comfortable.
Thank you. Okay.
Thanks, love.
Bye.